Thank you very much, Dr. Maniar, for giving that kind introduction. And I would be thankful to Malar Medical Association for giving me this opportunity to talk on early diagnosis of cancer. Uh, Dr. Rajesh Jain has called me that day, and he requested me to give a good quality of lecture where our general physicians can have means guidance for the diagnosis of cancer in early stage. So I will move forward to the lecture without wasting any more time. So first of all, I will discuss about the background. So I am going to share you the data for the incidence of the cancer uh, in the globally as well as in the India. So this data is according to Globocan 2018. So where they have reported 18 million cancer cases as a new cancer cases, and where 9.6 million deaths which were seen globally. So globally, if you see, cancer ranks among first or second cause of cancer-related death uh, before the age of 70. So it is predicted that by age 2040, cancer incidence and mortality is expected to rise beyond 19.5 million cases and 16.3 million cases respectively. See, these most probably are related to the new and challenging problems related to the rapid urbanizations which we are currently facing in our country as well. And so a lot of new molecules and treatment options are available for people who are diagnosed with other diseases, and because of which there is population aging, and because of the elderly populations is there, and they are getting a lot of cancers. So other issue is the inactivity. So a lot of people, so they do or have a sedentary lifestyles. So where most of the time they are inactive, and so they have unhealthy lifestyles. So regarding the foods and all. So this is also leading to the development of the cancer. So there is definitely indoor and outdoor air pollutions, so which currently we are facing, and that is also a contributing factor for the cancer development. See, lot of times patients do come to OPD and they will tell us that I don't have any bad habits like smoking, alcohol. How I how I can develop a cancer? So for those type of patients, I can say that so issue behind development of the cancer is not only related to bad habits like smoking and alcohol consumption. So it is related to pollution, unhealthy lifestyles, that is low basic activities and food habits. So all these events, these are responsible for emerging cancer burden across the globe. So majorly, these are the impacting on middle to low socioeconomic countries, including India. So now I'm moving towards the situation in India. So we can see in this diagram. So if you see across all population, so most common cancer here we can see is breast. So this is according to the data of Globocon 2020. So breast cancer is the commonest cancer across the all ages and both the sexes. So followed by the lip and oral cavity cancer. That is followed by cervical cancer and uterine cancer, and that is followed by lung cancer. So whereas if you see across the globe, lung cancer is the most common cancer, followed by the breast and colorectal cancer. But in India, the situation is different. So breast cancer is the commonest, and most probably this cancer is commonest because the urbanization. So lot of urbanization. So there, women are getting breast cancer as commonest cancer. So when we divide the cancer according to the ages, so men's they do usually have lip and oral cavity cancer as most common. So a lot of people they are chewing tobacco. So they are using tobacco in a lot of different forms. So that is the contributing factor for the oral cavity cancer. See, definitely viral issues are also there, which are also contributing to the oral cavity cancer. It is HPV virus that is there. See, this is followed by the lung cancer, stomach and colorectal cancer, which is commonly seen in the men, followed by the women. So where definitely the breast cancer is again the most common cancer, followed by uterine and cervical cancer, ovarian cancer, and here also they got lip and oral cavity cancer. So if you see our population, that is 138 crore population, so where we have currently 1.3 million cancer cases throughout our country. So this is new cases they are getting for the cancer management every year in India, and we are facing approximately 0.8 million deaths per year. So if you see the prevalence of the cancer throughout the this year 2020, it is 2.7 million cancer patients at a point. So this is the summary of the incidence and mortality which just now I presented to you. It includes the populations, both the sexes, and again, so I'm going to discuss you about the age standardized index, incidence of the cancer across the world. So see, this is the age standardized incidence of the cancer throughout the world, includes top 10 cancers. So here you can see breast cancer is the commonest amongst women, and followed by lip and oral cavity cancer. So that is most common in the men's. So this is the incidence and mortality of the top 10 cancers. This is in the world. So you can see this slide. So here you can make it out. There are changing incidence of the cancers. So you can see in this slide, in 2004, the incidence of cervical cancer in India was commonest. So the cervical cancer was commonest in 2004, but now the incidence has changed. So you can see the lung cancer, which was the top, not at the bottom of the this slide in 2004, this has shifted to the uppermost part. So incidence of cervical cancer has significantly decreased. So because of the screening, so the screening has started, and a lot of newer patients are getting diagnosed prior to the development of the malignancies. And so rest of all malignancies, so their screening problem, screening is, means cancer screening is not that effective, so we are not able to get diagnosed that type of cancer, maybe because of the our nation's I can say the conditions, finances, so which they are contributing for the patient's management. And some cancers have similar incidence that hasn't changed. So why diagnosis of cancer in early stage is so important? So now I'm going to go through the slides where the incidence, not exactly incidence, so the mortality of the cancers according to the stage will be described. So you can see the slides, so where the incidence of lung cancer is shown along with the probable survival, 5-year survival. So here you can make it out. So survival for stage 4 lung cancer is only 10%. So 5-year survival is very low. If we compare the stage 4 survival of this lung cancer to rest of all stages, stage 1, stage 2 and stage 3, so the all earlier stage will have good survival, good overall survival. So that would be more than 20%. So for stage 1, it is more than 80% survival. Stage 2, approximately 70 to 80%, and stage 3 is that is in between 20 to 60%. So that depends. So again here I have shown the similar profile for the lung cancer, but it has distributed among NSCLC and SCLC. So SCLC is on that side, so this is small cell lung cancer. You know that this is very aggressive type of cancer. And NSCLC is not that aggressive, but see, incidence is variable. So NSCLC population is, means incidence is in between like 70 to 75%, and SCLC incidence is between 20 to 15%. So depending upon this, so if we are able to diagnose this NSCLC lung cancer, that will not have a small cell component. So that is very good if we are able to diagnose in the stage 1. So that would be 90%, and again in the stage 4, 10%. Similarly, we can see in SCLC there are two stages. One is limited stage, means tumor is limited to one field of the radiations, and extensive, the disease has spread to the other organs which cannot be included into the one field of radiation. So this tumor has a different staging system. So for limited stage here, survival is not that good still. So coming to this slide, this is slide of head and neck cancer 5-year overall survival. So here also you can see this is Kaplan-Meier curve showing overall survival benefit for the stage 1 tumor, stage 1, stage 2 and stage 3. These type of stages do have a better survival when we compare these stages to the stage 4. So we'll see the survival for the breast cancer. Again here you can make it out, survival for stage 4 breast cancer is very, very minimal, that is 22%. Rest of all stages do have a better survival when we compare. So this is data that is published in BMJ in 2019 for the cancer survival data. They have given more emphasis for the importance of the early diagnosis. Why they have given that? So they have showed that the most cancer survival at 1 and 5 year is much higher in the cancer that is detected in early stage than if it is detected later stage. So this emphasize they have given this for the early diagnosis. For some cancer, stage detection is not that important. So like prostate cancer, so where prostate cancer, when it is diagnosed in any stage, so 1 year survival is not that much of affected, so that is around 100%. And some of the cancers, they really do matter, so survival is compromised if they are getting diagnosed in the later stages. So cancers like Hodgkin's lymphoma, survival is generally not matter according to the stage of the disease. Even stage 4 Hodgkin's lymphoma, they do better, and survival for a year is around 86.7%. This is good enough. So other example, that is colorectal cancer, where survival is very much compromised if this type of cancer is diagnosed in the later stage, that is stage 4. So survival is compromised. If you see the 5-year survival of the colorectal cancer is only 40%, and if you see same cancer with the stage 1 survival, so that is 97%. So there is huge difference between the stage 1 and stage 4 of the colorectal cancer. So that's why the survival for this is very, very dismal in the later stage. Again, you can see for the lung cancer, survival for the lung cancer in stage 1 is 87.3%. And that is very much dismal, that is 18.7% for stage 4. So what actually is the means detection? What do you mean by early detection? Early detection has two components. So when we say it's screening, so screening is most commonly done for the patients who are asymptomatic. So they don't have any signs and symptoms of the means cancer. So there we usually do for the screening, and those patients who are very much symptomatic, so there we have to keep in our mind that the symptoms which patient is getting, if they are not related to disease or communicable disease, then we have to keep in our mind that this could be a symptom or sign of the malignancy, and accordingly we have to order the specific investigation judiciously. So there should not be any means over diagnosis like we routinely see with the prostate cancer. So ordering investigation judiciously is most important thing, and that should be done according to the clinical history and physical examination of the patient, and that should be done according to the complaints which they are showing to you. So just now I like discuss you about the screening. So screening we used to do for the patients who do not have any type of symptoms, and so usually we will get means some of the patients will be able to get the disease without any symptoms. See, this is the newer publication, so which is shown in the ESMO. So where they have started collecting blood sample of the peoples, so where they are doing screening, a type of screening where we can make out the cancer by taking only blood sample. So what they are doing in that, so they are removing circulating tumor cell DNA and they are sending it for investigations. So this ctDNA, so they are able to take it out, and from there that they are able to make it out, so which type of cancer patient can have in future. So this is one type of screening, and this may be the future. So I thought I should discuss this slide with you. So according to this, they have done one study that is called as Pathfinder study. So this study is reported in recently in ESMO in 2022. So they have included 6,621 people whose age was more than 50 years. So amongst these people, they have collected blood sample and sent it for investigation, and they counted the ctDNA. Approximately 1.4% of the people test positive for multi-cancer early detection. So they got the samples, and out of those people, so 38% patients were confirmed to have cancer. And so for doing all this type of tests, so median time to achieve a diagnostic resolution was only 79 days. So that was good. So this type of test, they have a good sensitivity. That means they will say which type of peoples they will have actually cancer, and good specificity. So means they will exclude the peoples who really do not have cancer. But so a lot of more data is required. Currently major randomized clinical trials are going on for this evaluation, and maybe this could be the future later on, so where we can do cancer screening later on with the blood only. So now I'm going to discuss or tell you about the case study. So she was 40 years old, and she presented to general practitioner for dry cough for 15 days. And she had taken a lot of antibiotics and evaluated multiple times with no response. So general physician did chest X-ray, and this was that chest X-ray. Sorry for the quality of the X-ray, but it was looking absolutely normal. So there was no abnormality. So you can make it out. So the patient's cough was persistent throughout for prolonged period of the time, and many chest X-rays were taken in between before somebody has recommended to go for the CT chest. So when CT chest was done, so there was mass that was seen in the left lower lobe, and that was located medially. So after getting that CT scan done, so we have ordered PET CT scan, and PET CT scan is showing the mass. Right, you can see where the shadow of heart is there on the chest X-ray. So it was actually behind that shadow, and it was hidden. So nobody was able to see that on the chest X-ray, and patient developed brain mets, liver mets, bone mets, and she's a young lady, so nobody has thought it could be a lung cancer, and everybody was like giving antibiotics and repeating X-ray. So lastly, CT test was done, and fortunately, she was diagnosed with the lung cancer. So I'm just showing this case. After 3 cycles of chemotherapy, the mass has significantly gone down. So why I'm telling you this, just to like tell you that, so somebody has suspected that this could be something else, and somebody has done the CT scan. So that thought is important. So we have to suspect. So whenever we are coming across any type of unusual complaint, so we are ruling it out. So it is not related to infection or related to non-communicable disease other than the cancer. If they are all ruled out, so we should think about the cancer. So thinking on that, so we'll be able to get some diagnosis early. So right now I'm going to tell you the general symptoms which routinely present are seen with the cancer patients. So fatigue is most commonly seen, and other is the lump or area of the thickening that can be felt under the skin. So recently, last week I got one patient. So she come to me with all the reports, sonography, CT scan, and PET CT scan, biopsy. So she got a leiomyosarcoma, and that was started from IVC. So I asked, what are your complaints? So she told me, nothing, I don't have any complaints. So I asked, how you come to know that, so you have this much? So she told me that, so one day I was sleeping, and I put my hand on my tummy, and I felt something hard. So for that, she went to a general practitioner, and he did sonography. And with that, so there was huge mass in the liver. So it was around 12 to 15 centimeter mass. So that was coming from the IVC and going to the liver. And she palpated that, she felt herself that mass. So why I'm telling you, so importance of the physical examination. So when you touch the patient, definitely you will come to know the mass and all. So physical examination is most important part of the cancer diagnosis. So the breast is the tissue where we can routinely feel the lump and thickening or anything, any abnormalities, skin changes on the inspection. So that we should see whenever somebody complains of the like breast issues. So other thing is the weight changes, including unintended weight loss. So this is most commonly seen with the leukemias and lymphomas, where patients usually do lost lot of weight, more than 10 kg. Some of the solid malignancies also we can see the weight loss. So skin changes such as yellowing, darkening, redness of the skin, sore throats that won't heal, changes to the existing mold. So when we see, already I told you the incidence of the head and neck cancer is much more in our country. So these are the cancers which can be easily figured out. So just we have to see non-healing cancer ulcer. So if it is there in the buccal mucosa, tongue, you have to go for the biopsy. You should not wait for giving the trials of the multivitamins, antibiotics. I know that leukoplakia is most commonly seen in the people prior to the development of that type of disease, but still it is better to do evaluations so that it should not spread, and the chance of getting cure is much more better when we diagnose head and neck cancer prior to the extensive stage. And treatment is also means very much minimized if we are able to diagnose head and neck cancer prior, means in stage 1, stage 2, where there will not be any need to go for the chemotherapy, radiation therapy, surgery will
Sir,
suffice.
last 5 minutes. We'll finish.
Okay, yeah, fine. So I'll just go with the symptoms and then I'll stop. See, you have to see for the changes in the bowel bladder habits, so where you can find out the cause. Bowels, you have to see for the change in the habits like loose motions, constipations, along with the bleeding. So for bleeding, most of the times bleeding per rectum, we usually think of only piles. So a lot of pile patients, so means there would be 90% of that could be the piles, but 10% it could be the CA rectum. So that we have to see. Persistent cough and trouble breathing, that could be related to lung cancer. Difficulty swallowing, it could be related to squamous cell, means C esophagus. Hoarseness of voice could be related to CA larynx. Persistent ingestion and discomfort after eating could be related to stomach cancer, that we need to see. So in all cancers, when we are suspecting cancer, so these are the routinely investigations which we will be performed. So this will include complete blood count, blood chemistry, tumor markers. This I have specifically mentioned the serum protein electrophoresis for myeloma diagnosis. And biopsy is most important part. So whenever we are suspecting any lesions, we have to go for the biopsy rather than going for the fine needle aspiration, because biopsy is going to tell us a lot of more things. And PET CT scans that we have to perform for the staging workup. So looking at the CBC, so we can diagnose many times blood cancers. So we just have to see WBC counts, and we have to compare this count with the hemoglobin and platelets. So if count is on higher side and hemoglobin and platelets on lower side, so could be possibly related to acute leukemias. If hemoglobin is in normal range and there is thrombocytosis along with the leukocytosis, could be related to chronic leukemias. In blood chemistry, we can make out myeloma very easily if we look at the liver function test, which will tell us about the albumin and globulin levels. If globulin level is on higher side and patient has chronic back pain, anemia, so this could be related to myeloma, where we should send serum protein electrophoresis. So that will help us to diagnose myeloma in early stage. Because see, elderly people, they have most common complaint related to back pain. That we should see with the LFT. If we are getting high globulin, definitely we should send serum protein electrophoresis. But see, this should be clinically related. So patient should have anemias, deranged renal function, and high globulin. So serum protein electrophoresis is definitely going to help us, whether it's related to myeloma or not. So that is, if you have any doubts, you can ask me. Thank you very much.
Thank you, sir, for the wonderful session. The take-home message from this is that symptoms which are looking common to you, okay, and that are not responding to your common line of treatment, you need to consider about the working up of cancer, right? The symptoms which are look like coughing, it's a common symptom, but when it is not responding to your common treatment, a normal duration of time, then we need to consider about the cancer treatment. Thank you. Thank you, sir.
Yeah. Thank you, Dr. Vijay, for the excellent lecture. Please, sir. Sir, Vijay, sir, please. I request our chairperson, Dr. Rajesh Panchal and Dr. Jay Joshi, to please felicitate Dr. Vijay Sharnagat.